Good morning. My name is Faraón Axel Hernandez Nava, and today I'm going to talk about the project called Biomedical Stays, which is developed in Puebla's hospital. A brief description of this project is that it has the intention of meet the requests of the clinical areas where the staff of the biomedical area is requested. In this case, we're going to develop three principal activities: calibrate, check, and supervise. In this part, we're going to do these activities principally with the devices because we're going to work with brands like General Electrics. We're going to work within uh, surgeries and the different areas which hospital provide us. Then we have a general objective. The objective is strengthen theoretical knowledge in the technical and professional biomedical part, calibrating, monitoring, and supervising the medical and biomedical devices within the hospital, as well as supplying the department some resources to the staff of the clinical areas who request it. An important point is that daily we're going to fill out a checklist because with this the hospital confirms that we are making a good job with the requests. Well, we have a goal. The goal is going to be explained detailing in the following in the next slides. And this goal is that the student can attend to a request without the support of the staff of the area and attend it on a timely manner. And obviously we have some specifications in this project. It's necessary to understand two principal topics: the theoretical concepts and the medical and biomedical devices operation modes. Well, in theoretical concepts, we have to understand and know what is the normal value of vital signs on neonatal, pediatric, adult, and geriatric patients because these values are not the same in the different ages. And sometimes a common uh, error in the area is that the doctors assume that the devices are working wrong because the configuration are not in the patient that we are working it with. And obviously we have to know how to analyze different waves with different biopotentials, principally electrocardiogram, electromyogram, and electroneurogram waves. And obviously we have to understand what are electrodes and which types of electrodes exist and in which or what activities we can use it. Well, talking about the devices, in this list we can notice that there are many devices, but if we don't know how to use it, it's very difficult to work right in the hospital. Well, talking about the development and its working at the pair with the goal, we have three project stages: the capacitation, the student without supervision, and the student with supervision. The capacitation, it's the base of this project because the engineers are going to show us, in this case show me, the how the hospital is divided. It is divided in four floors, in which uh, we can see that exist operating rooms, hemodynamics areas, neonatal areas, emergencies areas, X-ray, fluoroscopy, and CT areas, and the intensive care unit. In this part, the engineers taught me how to calibrate, taught me how to move into the hospital, taught me how to talk with the nurses, with the doctors, and and show me how to do the things right. And then we have the second stage, that is the student without supervision. In this part, it's very important to tell that it's working at the same way with the capacitation stage. In this part, the engineer uh, led us work without the help of him or her, and let me work with all the devices. I do it by myself, but then the engineer checked if I did it right or wrong. And if I did it wrong, uh, they tell me the correct way to do that. Then the last stage is a student without supervision. In this part, I am working by myself, and the clinical stage is going to tell that if I did it right or wrong. And finally, we have the results. In this part, we can notice that I calibrated a defibrillator, and in the other image, we can notice that I was working in a surgery of a tumor. Finally, the conclusions. The role of a biomedical engineering within the hospital are very important. All the responsibilities that area assigned to us involve a high commitment with the clinical staff and with the patient. There are too many areas in which we can innovate in this project, but after all, working in the same way as we were working is good because we're prioritizing the health of the patient, giving them the better devices to them surgeries, procedure, or treatment. Definitely, the biomedical engineers are the bridge between patients and doctors. Thank you very much.